and this is the Trauma Advanced EMT Skill Station. So, without further ado, we'll get it going. Okay, so we get a call that there has been a motor vehicle accident, and on our way to the scene, we're driving, and when we arrive on scene, we want to make sure we have proper PPE. We want to make sure the scene is safe. So police have made sure that it's safe for us, that vehicle isn't in any danger of exploding, things of that nature. This time, we want to determine the amount of patients we have. So we get told that there's only one, everyone else is fine, so we have one patient. We want to create a general impression. General impression right off the bat is that they're not doing that well, because we can see there's blood coming from their shirt and that they're having trouble breathing. So this time we want to be working fast. Hey sir, can you hear me? I want to get my level of consciousness. Seems like they are still conscious, but barely, not really responding to my questions, so I would say A&O times 2. They've also been in an accident, so I want to consider spinal mobilization. So at this point, I put a C collar on, and I can begin checking my ABCs. Okay, airway looks good. Breathing, okay, adequate volume, good. And then we're checking out the bleeding, and I see that his arm is gone, so that's an immediate life threat. So I want to take my tourniquet, and that's the lower part of his arm. I want to go above it, at least a handful. Don't need to get too close to it. Get really tight on there, and you'll know it's there tight enough, but you can either check the pulse and the pulse is in there, or the bleeding just stops. So now that we have a tourniquet on, we've checked our ABCs. We're gonna bring the patient down together. Again, I'm gonna do it on the count of 3. Maybe you could swivel up first. 1, 2, 3. We want to get the patient flat down as soon as possible. So we're just imagining that we're taking them out of the car and putting them onto the stretcher. Again, we want to check ABCs. He had a pulse before, pulse is still there, and he's having labored breathing. There is nothing in the mouth, no vomitive secretions or blood or anything. It's just he has a low respiration rate of 4. He's having trouble, really agonal breaths. And so at this point, I am going to want to help him out and check out the SpO2, put that on there as well. Have someone else be doing vitals and see that he has a SpO2 of 82. So at this point, I would start breathing for him with BVM, head tilt, chin lift. It's the easiest place to do BVM is down here at the end. So tilt the head back, about 15 liters per minute of oxygen, and so that's taking care of his breathing for now. As soon after, I want to check and see if an OPA, an adjunct, would be necessary. I think it would be in this situation. So right after, I would switch, put the OPA in, and that's great. Okay, and now that we've checked our ABCs, we can start getting ready for transport, and we'll do a secondary assessment in the back of the ambulance. So now that we've had him on the stretcher, we let him on the stretcher. We'll have someone else be taking vitals, someone else paying attention to the breathing. You can attach it to capnography, and if you're ventilating too fast, a lot of the time it's the capnography will have a low reading, so that is something to be looking for. And while that's happening and we're transporting, I can start my secondary assessment, check the eyes for pearl that are responsive, checking in the mouth again, I don't see any vomit. In the ears, monitors for cerebrospinal fluid, things of that nature. Palpating the spine, feeling the head, for any deformities. I don't feel any. At this point, I want to inspect the chest, push down, squeeze the deltoids. The patient is becoming a little more conscious at this time. I'm going to check CSMTs. Sir, you know what finger this is? Pinky says good. You squeeze my hand, good. And then do that with the other hand, great. Feeling up and down the arm. Again, we can be using our scissors to cut off clothes. You know, don't be afraid to, you know, ruin someone's clothing to help save their life. Check inside. We can also auscultate the lungs. Checking the breathing, make sure it's equal and bilateral. We want to make sure they're going at a proper rate, also great. Start feeling the abdomen. So we can move down. We want to squeeze in first on the hips before we push down. Great. And there can be a lot of blood loss through the hips because it can hold almost your entire blood volume in it. Great. Go down the foot. Same thing again. If you pull your foot, pulls it back towards. Can you tell me which I'm squeezing? Great. What tone am I squeezing? Great. Do you pull it back up to you? Do you push it away to you? Great. Finish my assessment. Then at this point, I want to check the back. Okay. Roll with me on 3. 1, 2, 3. Rolling out, checking the back of the spine all the way down. Good. Back of the legs. Great. Lay the patient back down, uncross their legs. Okay. And at this point, I've done my secondary assessment. I can try to obtain a sample history, you know, signs and symptoms, the allergies, the medications, past medical history, last oral intake, and events leading up. But the patient has limited consciousness, so I don't know how effective I'll be able to do this. At this point, I really just want to be monitoring vitals. Consider starting IV. You know, you want to be watching the oxygen level, making sure we're having proper ventilations. And at that point, yeah, we're just rapid transporting to the hospital and monitoring the patient as best we can. Great. Thank you.